Welcome back. I'm Chuck Gill. I'm the Vice President of Public Affairs here at Central Maine Medical Center, and today we're talking about the Central Maine Heart and Vascular Institute. I'll be talking with Susan Horton, who's the Executive Director of this program. Susan, good morning. How are you?
I'm great, thanks, Chuck.
CMHVI, the Heart and Vascular Institute, is the newest heart center in Maine. Can you speak about our unique approach to patient care?
Sure. The Heart and Vascular Institute was really founded on seeing what we could do to improve the lives, the quality of life for our patients in the 400,000 population that we serve. We really looked at what does the evidence tell us, how do we take care of those patients so that we involve the family in that transition of care to have them safely cared for in this institution and then at home.
Good. CMHVI, or the Heart and Vascular Institute, is a leader in innovative cardiac programs. We're the first chest pain center, a PCI center, the leader in emergency angioplasty, a new program we heard about earlier, saving lives, a number of firsts. Why did you invest the time and effort to develop these new programs?
Number one, it was the right thing to do. But really, we had an opportunity, being a new program, to say what were the things that we could do that other programs wish that they could. It's very hard when you already have an existing infrastructure to have that ready-made adaptation, innovation. We had it from the ground up. We were able to say, what does the evidence tell us? What are the things that we can and should be doing for the community, for these patients, and how do we implement those guidelines? We had no structure to begin with, so we were able to do that and do it appropriately. We looked at what was appropriate for accreditation, looking at quality, saying how could we enhance the care that patients receive. So, for instance, we said it was important that patients coming to a chest pain center were treated in a timely fashion, that they would follow national guidelines. We became the first accredited chest pain center in the state of Maine back in 2005. We then said, okay, if that's important, how do we make sure that when patients are having a heart attack, that we take the care that they are receiving and make it as timely as possible, knowing that those 90 minutes, that window is so important. We said, let's put ourselves through a process of accrediting our chest pain center as well as our angioplasty center. We became the first accredited angioplasty center in the state of Maine in 2008. Again, a national certification. All of the programs that we have, whether it be our vascular labs, our diagnostic centers, our nuclear medicine program, all are nationally accredited. We felt that that standard of quality was important for our patients to know, for our community to know, and so that we put ourselves to that test each and every day.
Very good. So you also participate in a number of professional quality organizations, such as the Northern New England Cardiovascular Study Group. Why is it important to invest your time and effort into these type of consortiums? Mm-hmm.
I think for a lot of good reasons, not the least of which is that we can learn from one another. There's a lot of learning in that sharing and saying what's the best practice, what does the evidence say, and how are you implementing that evidence-based practice into your practice, so we can learn from one another if we take the time to listen. We participate both regionally and nationally. For instance, we started belonging about a year and a half ago to the National Hospital to Home, H2H program through the American College of Cardiology, really looking at 30-day readmissions, for heart failure patients as well as acute myocardial infarction patients, knowing that patients, once they're in the hospital, they don't want to have to come back within a short period of time. So what are all the transitions of care that we can do that can make a difference? We believe that our model of care here with single stay really enhances that hospital to home transition. We've been able to partner with the Androscoggin Home Care and Hospice to help us on that initiative. So we've really reached out to our community partners to make a difference.
Also, you've reached out to the EMS community, I believe, in a big way to improve time to get people to the hospital having a heart attack. Can you talk a little about that?
Sure. Again, looking at the national databases, we actually were fortunate in that the American College of Cardiology recognized Central Maine about a year and a half ago for our heart attack care processes, and actually came and spent 3 days filming with us. How did we respond, and was the response something that they could take out to other community hospitals in terms of heart attack preparedness? Again, back in July of 2005, was through the emergency room, through physicians like Dr. Kevin Kendall, going out and teaching and training emergency staff to recognize a heart attack in the field, what we call a ST segment elevation MI, or STEMI. And from that recognition, we were the first in the state to say, we trust your judgment. We know the education you've received. You can activate our cath team 24/7 if you recognize in the field a patient having a heart attack. So why that's important is that if a patient is having chest pain and they appropriately call 911, probably the most important thing that you can do to save a life, contacting 911, having ambulance come to the home and take you to the emergency room, closest to emergency room when you're having a heart attack. And to be able to then look at and know that from the field, they're activating our cath team. When you get here, our cath lab staff are ready. Physicians are ready, lights are on, team 24/7, doesn't matter what time of day or night, the team is ready, and that is a life-saving process, has really made a big difference in terms of our ability right now to be the best in the region for heart attack care.
And time really is muscle when you talk about heart attacks.
Absolutely.
Good. What is the Advanced Heart Arrhythmia Program? That's a lot of big words. So what is heart arrhythmias and what do we do here?
Well, heart arrhythmia really means, arrhythmia means heart, irregular heartbeat, or rhythm that is not pumping appropriately. And so what we've been able to do, again, since 2005, is have a program where we have board-certified physicians that can diagnose and appropriately treat, based on national guidelines, whether it be with pacemaker or defibrillator, those heart rhythm abnormalities. So really the appropriate management of those patients. So rhythm abnormality, how do we diagnose this, how do we treat it in a very sophisticated way.
So we have subspecialists in that
Subspecialists
area of
in
cardiology working
correct.
here.
Absolutely. And really adhering to the evidence-based guidelines. So again, any device that we would put into a patient, it would meet the national standards and guidelines for appropriateness. And we have quality review processes in place where we look at the work that we do on a monthly basis. Again, going back to some of that accreditation process, that's part of what we do as a team.
Well, I guess kind of a closing question. We talk about quality cardiac care close to home. We have a program here in Lewiston. We have 10 or 12 outreach sites. Why is it important to have quality care close to home?
Well, I think for a number of reasons. When you look at the state of Maine, we certainly are a rural state. Beautiful state, but rural. And the wintertime especially makes travel very difficult. So to be able to, for me, to deploy our specialists to go out and care for patients in the region whenever possible, that makes a difference to our patients. So what we try to do is to support the local community hospitals, providing diagnostic services and care where appropriate, when appropriate, and when patients need more advanced tertiary services, advanced cardiac services, that's when they would come to a center like Central Maine. So we really have the best of both worlds. We have the experts going to where you live, where you work, and then the care that cannot be provided at that local hospital comes and is provided here.
So quality care close to home does make a difference in people's lives.
I believe it does.
That's it for our first show at Central Maine Heart and Vascular Institute. It is truly impressive, the comprehensive heart care and prevention of heart disease programs that they have at CMHVI. Next week we'll be back and we're going to get a second look at this incredible program of great service close to home.